Hi, I'm Kelly Davis, the owner of Skin Essentials Ledger Med Salon, and I am personally super excited that you've decided to take the steps to live your best life by optimizing your hormone levels. Our team of nurses specialize in BHRT, which is Bio-identical Hormone Replacement, along with cosmetic injections and cosmetic procedures so that our patients and clients look and feel their best. We are here to help you every step of the way, so the next part of this video is going to show you what to expect on your first service, and it's also going to show you a little bit about the supplements that go along with hormone optimization to make sure that all of your levels are optimal. We look forward to serving you, and we look forward to partnering with you on you aging healthier and happier.
The purpose of this video is to give you a little bit of pre-information before your appointment, so you can go in there with many of your questions answered, and you and your practitioner can just focus on you and what your needs are. Guys are pretty easy for the most part to have this conversation with and to balance, if you will. We're primarily just looking at testosterone in men. Women, a little more intricate details with all the other hormones that women need balanced, but guys are pretty simple. And really what our goal is to get your testosterone levels up into a more optimal range. And for males, that's around 1,000. It's really between 900 and 1,1200. And that's a first interesting concept I want you to understand, because often males come into our practices saying, you know what, I went to my doctor and he said my testosterone levels were normal. Well, just let me tell you that the lab reference range on a male testosterone is 200 to 1,200. So if you fell anywhere in that gamut, you're going to be called normal. Men start to feel symptomatic with low testosterone symptoms when their levels fall below 500-600. And a lot of guys don't understand that all those brain symptoms they're feeling, brain fog, can't focus, that it's on the tip of my tongue, the brain and the tongue aren't matching, that word search, afternoon fatigue, hitting a wall 2 to 4 in the afternoon, trying to find a Starbucks or a Red Bull or some sort of energy drink to get you through the rest of your workday. Mental fog, mental clarity, all those brain symptoms are testosterone decline. The lower your testosterone levels get below 500, the worse those symptoms become. As they get towards the 300, 200 and below level, men get irritable, anxious, very moody, have big mood swings. So a lot of the misconception of testosterone and aggression is really wrong. Natural testosterone in optimal levels actually evens out male moods. It doesn't make them aggressive. We are not trying to get your levels into an aggressive level. That's 2,000 and 3,000 at our Reuters when they do injectable testosterone, they get their levels up really high. We're not doing that. That's not what we're doing here. And a lot of guys have this misconception that because they have a sex drive and they have a desire, that their testosterone level must be okay. Well, I can tell you guys rarely, if ever, lose a sex drive. But sexual function does go. And as male testosterone levels fall, 500, 400, 300, 200, erectile function gets less, morning erections decrease, and so forth and so on. So although a sex drive is still there, sexual function and performance is not what it once was as your testosterone levels fall. So brain fog, focus, all the brain symptoms, muscle mass loss. This is a big one that our guys complain about, and the big one that they say returns very quickly when they get their testosterone levels back up. They start to lose muscle mass. They start to get a belly around the middle. Well, that belly around the middle comes because as your testosterone levels fall, your cortisol levels go up, and that's what increases that belly fat. So we see a reversal in our guys in that actually pretty quickly, way quicker than the women. So if you have wives on this therapy, they're going to get very annoyed with you that you're getting into shape quicker than they are, but they'll get there. So muscle mass increase, stamina in the gym, endurance. I have runners, I have triathletes that get this testosterone pellet therapy, and they say their stamina is so much better, their post-workout recovery times are less, their soreness is less. So an overall change in your physique back to 20-year-old levels, and sometimes even better than 20-year-old levels, because a lot of guys have been low testosterone their whole life and they didn't even know it. we're finding more and more young men with low testosterone, in their 20s and on into their 30s. So this isn't just a problem of 50-year-old guys or older. This can be a problem starting from as young as 19. I have in my practice young guys. There's a lot of factors to that, environmental factors, hormones, interfoods, many things that I won't go into here. But I tell you that just to if you know somebody that is young or you think is too young for this therapy, you may want to think again if they're having some of these symptoms. What can you expect? Well, your practitioner has been trained in a method that doses testosterone specific to you. We dose the pellets on parameters of your age, your weight, your blood levels, your activity levels, and then we retest you 4 to 5 weeks after your insertion to make sure your practitioner did their job and got your levels where they need to be. If you were underdosed for whatever reason, if any reason, we rarely have to do this, but your practitioner will bring you back in for a booster because it's our job to get your levels right and we want to know what your dose is so moving forward, we know what works for you. So most guys can expect to come in for their hormone pellets about twice a year, and that sure as heck beats the weekly injections that a lot of guys have to do. Moreover, the long-term benefits of having your testosterone levels up and balanced 24/7, huge reductions for men in Alzheimer's disease risk reduction, 70% for men. What we find is men with a low testosterone are 3 times more likely to develop Alzheimer's dementia, so very protective for the brain. Heart protection, lots of studies coming out in men over 55 or who studied that show actual reversals in plaques in the coronaries and decrease in reduction of coronary artery disease. So many other things in women, osteoporosis, osteopenia protection and breast cancer protection, prostate protection in men. A lot of guys have this misconception that they can't get testosterone because they've had prostate issues in the past or prostate cancer in the past. It's actually increased estrogen that stimulates prostate cancer risk. So as a man ages and his testosterone levels fall and his estrogen levels come up, that's what stimulates that prostate cancer. So we do this therapy in prostate cancer survivors when they're 2 years out. We have many questions that we answer in the consult, but what I found in my practice after thousands of patients is often we give you so much information you forget a lot of the key things, like how long does it take to work, how long does it last, and so forth. So those are the questions I'm going to briefly answer for you here. First question is, when will I feel good, right? So how long will it take me to feel good? So the majority of patients report, men and women, that first week their sleep is improved. Sleeping all through the night for the first time in many years for a lot of people. By the second week, that brain fog is kind of lifting. It's a good analogy is, I've been walking around with the dimmers on and the dimmers are coming up and I can see and I can think clearly, right? So about that second week is when those symptoms start to relieve. The brain fog lifts, the mental clarity, mental focus. By about the third week, we're seeing, and sometimes even sooner, moods level out. Anxiety is lifted if you were having some of those symptoms. The mood swings are going away, which makes your family very happy, right? Your significant other, your children, everyone around you, your coworkers, and so forth. So expect that about 2 to 3 weeks. 3 to 4 weeks is when you're really on a climb towards the peak of your hormone pellet therapy. And that's when women report an energy surge, a libido surge. A lot of guys are going, when are you gonna get your sex drive back? Well, that typically kicks in at about 3 weeks. So at the 4-week peak is when you peak on your pellets, and then after that is when we want to get your blood work. So somewhere between 5 and 6 weeks for men and women is when we're going to get your blood work to make sure your practitioner did his or her job and got your hormone levels where they need to be. If you're underdosed for any reason, they will bring you back in for a visit and possibly do a booster on you. And that's just to get you right. So moving forward, we know what your sweet spot is, what dose you need, and in subsequent rounds, we know where your needs are. After that, women typically last somewhere between 4 and 5 months. Men last somewhere between 5 and 6 months. You'll know when it's time to come back in for your repeat insertion because those symptoms that were lifted will start kind of creeping back in, somewhere around that 4, 5, 6 month marker. And if you don't notice it, trust me, one of your significant other or your partner or your children, somebody will notice it and you'll know it's time. Most practitioners don't get lab work every time you come in for your pellets. It's not typical. We typically get blood work once a year after we've established your dose, just to kind of keep an eye on things and make sure everything's kind of humming along the way it should be. I hope this helped you out, and I wish you well. Welcome to your new life. I'm Terry Denai, founder and national spokesperson for Avexius Health Solutions, and I want to talk to you today about some of our supplements, our nutraceuticals that we highly recommend our practitioners utilize in their hormone optimization therapy. Now, Avexapel is our hormone optimization method that utilizes hormone pellet therapy, but we also look at several other key factors of hormone optimization like methylation, metabolism, receptor site activity, and there are some key nutraceuticals that optimize hormones through those channels. The first nutraceutical I'm going to talk about today is B-complex. Now, a lot of people wonder, why B-complex? What is B-complex going to do for me as it has to do with hormone therapies? Well, very, very important part of hormone optimization is how we metabolize in the liver, especially estrogens. Now, when I talk about B-complex, I'm not just talking about patients that are coming in and getting hormone therapy. I'm talking about any form of estrogen that is in our body, whether it's from our own bodies making it, ovaries make it, it's made in peripheral fat, whether it's hormone therapies via pellet therapy, via an oral estradiol, or some other form of hormone therapies. Men and women both make estrogen. And it's so important when our bodies are making and utilizing estrogen that we metabolize it in favor of what we call the good estrogen. And a key part of that is methylation. So it's so important that your B-complex have not only all of the B vitamins, but a methylated form of B12 and methylfolate, and that just aids in the metabolism and the detoxification and the shift in the estrogen metabolites in favor of what we call the good estrogen, and so you can excrete what we call the bad estrogen. Now, the other thing that B-complex has in it that's really important are all kinds of great B vitamins that help with brain health, with mood, with memory, focus, mental clarity, and so forth. Sometimes we have patients come in and they're still having a lot of symptoms of hormone imbalance, and then we'll ask them, well, are you taking your B-complex? Oftentimes they say no. They start taking it, they see a huge difference. Next, I'm going to talk about DIM. DIM is short for diindolylmethane. Now, DIM is something that's found in cruciferous vegetables in abundance. It's a really important nutrient that helps us metabolize estrogen, again, getting that good estrogen. No matter our exposure to estrogen, whether it's through a hormone therapy or whether it's through the environment or whether our bodies are making it, it's really important that we favor the 2-hydroxyestrone pathway. That's the good estrogen. The bad estrogens are the 4 and the 16. We don't want those. We want those excreted out our GI tract, out of the system. The other thing that DIM does is it helps increase our free testosterone. So there's a protein called sex hormone binding globulin, and it binds up free testosterone. But sex hormone binding globulin actually likes the bad estrogen better, but it needs DIM to help with that conversion. So when you take DIM every day, and for women that's about 150 to 300 milligrams. For men it's anywhere from 300 to 600 milligrams depending on your needs. What that does is it knocks free testosterone off sex hormone binding globulin and grabs up the bad estrogen. So you kind of get a double bang for your buck with DIM. Very protective to the prostate, very protective to the breast tissue in that regard, and just really gives patients that are on any kind of testosterone therapy or hormone optimization just that more bang for their buck. Make sure you're taking your DIM if you're on any hormone optimization. One last thing I need to say about DIM. Not any DIM will do. You can't just go into a nutrition shop or a vitamin shop and pick up DIM, because it has to be specially formulated in a micronized form, and that is very, very hard to find. Our DIM is a proprietary blend that is micronized DIM, very important for your hormone optimization regime. The next supplement I'm going to talk about is vitamin D, specifically in the form of ADK. Now, it's really important that all three of these be taken together. They balance each other out. Anytime you take a vitamin D supplement, which now is very common, everybody's really getting the message that vitamin D is very, very important. It raises calcium levels, and calcium is fortified in everything. We're way over calcified in this country because there's calcium in everything. Calcium is the main ingredient in concrete that hardens concrete. So all this extra calcium roaming around our bodies is not good, hardening arteries and all kinds of things we don't want hardened. But what vitamin A-DK has in it is vitamin K2. Now this is different than vitamin K1 that's found in green leafy vegetables that has to do with clotting. That is not what this K is. This is vitamin K2 in the form of minoquinone 7. That's a very important analog of vitamin K2 that helps shuttle calcium into the bones or the teeth or excrete it out the kidneys, wherever it needs to go. So very important that your D supplement is combined with K. Now vitamin A balances out vitamin D, and another really important supplement to take along with your ADK is magnesium. Magnesium citrate, magnesium glycinate, any of those is really important also to help with calcium absorption, calcium metabolism. We just don't want to be overcalcified. We want that calcium to get out of our bodies or into the places where it belongs. The other thing about vitamin D is a lot of people think they're taking enough, and really an adult daily dose is a minimum of 5,000 IUs. Another thing that people misunderstand about vitamin D is their vitamin D levels. So many healthcare providers are testing vitamin D, and that's so important, but unfortunately the reference range for vitamin D is between 30 and 100. Now the reason that's the reference range is because we know anything under 30 increases the chance for rickets. You know, rickets has been eradicated in this country for decades and decades. But what we know now is vitamin D levels really need to be up above 60. In fact, 80 is optimal. We're all about optimal levels of hormones and vitamins and all of those things, not just enough in the reference range. Levels below 60 can hold a 5-fold increased cancer risk, 160% increased risk of heart attack, and when your vitamin D levels are low, in combination with low testosterone levels, your risk of all cause of death goes up 4-fold. So very important to get your vitamin D, but also that you have the companion nutrients of A, D, K, and magnesium. The next supplement that I'm going to talk about is iodine. Iodine is a very key mineral. We're actually multi-mineral deficient in this country. Oftentimes, you know, people are wanting to know, well, they always ask me, what kind of vitamin supplement can I take? Well, it's really minerals that we need. I've already talked about a couple of minerals, but iodine is a really key one, and we're very low in iodine in this country, for actually worldwide, truthfully, for many, many reasons. One of the number one reasons is our soil is very demineralized. We're not growing our foods commercially in really good iodine-rich soils. The other thing that happened in the 70s is iodine was actually taken out of commercially prepared foods as a supplement enhancement. Fortified is the word I'm looking for. Iodine used to be fortified in baked goods, but now it's not. They actually have something in there called bromide, which is not really very good for us. We need iodine. It's very protective to all the glandular tissues, thyroid, prostate, ovaries, breast. Low iodine is highly linked to fibrocystic breast disease, breast cancer, but specifically thyroid and thyroid issues. Oftentimes we'll have patients come in to our offices, to any of our clinics, our Avexius Health Solutions providers that will have many symptoms of low thyroid, and oftentimes just supplementing with some iodine can really help with that. So iodine, very important to get. It's very difficult to test. The most accurate lab indicator is actually a 24-hour urine test. Very difficult to test for, but just suffice it to say the majority of our population is low in iodine. It is very difficult to get too much iodine. Symptoms, the number one symptom of iodine excess is a metallic taste on the tongue. Now, in a decade of recommending iodine in higher doses to my patients, I have never had a patient complain of that. We recommend 12.5 milligrams a day minimally to start, and sometimes some patients take up to 50 milligrams a day, depending on what it is that they're treating. So iodine, very important mineral to supplement with. Hi, the next supplement that I want to talk about is a probiotic. So many people take probiotics, but they don't realize how important a probiotic is actually for hormone balance and for brain health. There's a whole gut-brain connection that's a whole nother teaching segment, but suffice it to say that taking a daily probiotic, a good quality, broad spectrum probiotic is key for optimal health. Our gut microbiome plays a very, very important role in but excreting the hormone metabolites that we don't want reabsorbed in our body. So having excellent gut health is really key for hormone optimization. It is also key for immunity. The gut is the gateway to our immune system. Imperative for serotonin production. It happens in the gut. A lot of people think serotonin comes from the brain. It starts in the gut. So poor gut health can be related to ADHD, ADD, depression, anxiety, mood swings, irritability, all of the things that we hear in our clinics every single day, because those are all hormone deficiency symptoms as well. So the whole point with talking about many of the supplements that I've talked about, including a probiotic, is it's so important not to just put gas in the tank. So many people are just getting their hormones, they're getting pellet therapy, or they're getting shots, or they're getting some form of hormone, and they're not optimizing that and making sure their body has what it needs to metabolize and to excrete the bad metabolites. Gut health is key to that. So get yourself a very good probiotic.